Welcome to those who have joined us for the Speech Pathology and Audiology Information Evening. I'm Ella, a Macquarie University Student Ambassador, and we are really glad to have you all with us this evening. We have a really amazing panel with us tonight, so I'm really pleased to welcome our 6 speakers. We've got Dr. Scott Barnes, the Course Director for the Master of Speech and Language Pathology, Associate Professor Madula Sharma, the Course Director of the Master of Clinical Audiology, Rebecca McNeil, who is a graduate of the Master of Speech and Language Pathology, Michael Badcock, who is also a graduate but of the Master of Clinical Audiology, Carla Gargan, a final year Master of Speech and Language Pathology student, and Helen Bishop, who is also a final year student of the Master of Clinical Audiology. So as you can see, we've got a really great panel here for you tonight that we'll be able to cover a lot of bases with. We'll start off with Scott and Madula, who will provide us with a course overview of their respective degrees. We'll then move into welcoming all speakers to participate in a panel discussion where you will be able to learn a little bit more about their personal experiences and their journeys into speech pathology and audiology and their experiences thus far in their respective careers. And then we'll open up to 2 live Q&A sessions, one for each degree, where we'll guide you through, when the time comes, how to assign yourself to each of those and ask the respective questions. So without further ado, I will hand over to Dr. Scott Barnes. Thank you.
Thanks a lot, Ella. I'll just share my screen very briefly. Okay, you should now be able to see some slides. Welcome to the Speech Pathology and Audiology Information Evening for 2021. We're going to begin with me and the Master of Speech and Language Pathology. I'm the course director of the Master of Speech and Language Pathology and have been in this role for quite some time. I'm a speech pathologist by training and became a researcher. My research interest is in the area of acquired communication disabilities. So people who have communication disabilities as a result of things like stroke and traumatic brain injury. And my research focuses on how we can facilitate communication and participation in everyday life for people with those conditions. So some of you might not be too familiar with what speech pathologists do and the kinds of people speech pathologists see. So I thought I'd begin there and talk a little bit about the breadth of the profession. So the headline here is that speech pathology is a professional field that works with people who experience communication and swallowing disabilities. They're the 2 key areas in which we work. And we work really far across the lifespan as well. So we're seeing people from very, very early in life to the very, very end stages of life, and with a variety of different kinds of conditions and needs. So as I mentioned a moment or 2 ago, a really key set of populations that speech pathologists work with are adults who've experienced a brain injury during adulthood, so something like a stroke or traumatic brain injury. We're also working with people at the beginning of their lives who may not be developing as expected. So children who might be late to speak or have learning or literacy difficulties, or broader developmental conditions like autism, for instance. We also work with people who have difficulty communicating via speech, so they might stutter or may not be able to speak altogether and need to use an alternative or augmentative communication system to participate in everyday communication activities. And we're also working with people at the very end stages of life who have conditions that deteriorate with age, so progressive conditions like dementia or motor neurone disease. So that really, I think, speaks to the variety and breadth of speech pathology practice. And as we'll see in a moment or 2, it really speaks also to the different kinds of workplaces that speech pathologists participate in. In terms of what we're doing with people with communication and swallowing disabilities, a really important first stage of contact with a speech pathologist involves determining whether they have a condition affecting communication or swallowing or not. So we're involved in the diagnosis of communication and swallowing disabilities. And if we determine that something is present, we're then identifying its important features. Once we've identified that condition, we're then implementing intervention plans for communication and swallowing disability. And if we can't eliminate or reduce the underlying condition, then we're thinking carefully about ways to reduce the disability associated with it and facilitate participation in everyday life. Now, speech pathologists, in addition to kind of working directly with clients, are also involved in improving speech pathology services. So we might be ensuring that evidence gets put into practice or doing independent research on speech pathology practice for people with communication and swallowing disabilities. And finally, and very importantly, speech pathologists have a role in advocating for people with communication and swallowing disabilities, ensuring that they're getting the services and things that they require. And we're also advocating for speech pathology as a profession, ensuring that people understand what speech pathologists do and what their role is. Coming to the degree at Macquarie itself, our degree is called the Master of Speech and Language Pathology. It's really important to keep in mind that speech pathology degrees in Australia are accredited by the professional body for speech pathology in the country, which is, really cryptically called Speech Pathology Australia. So this is a really important part of maintaining the quality of speech pathology as a profession and making sure that the public receive really high quality services from speech pathologists, regardless of where they study and where they graduate. So some speech pathology degrees will be undergraduate degrees, others will be postgraduate degrees. Obviously ours is a postgraduate degree. And we are accredited by Speech Pathology Australia. We're actually in the process of undergoing accreditation this year and have just had a big meeting with Speech Pathology Australia, and that went really positively. So this is our 5th accreditation. We've been accredited for a long time, and I anticipate we'll be accredited for a long time in the future as well. So basically, this means that if you graduate from a course like the Master of Speech and Language Pathology, you can practice as a speech pathologist in Australia. So the study pathway at Macquarie has a few different steps. The first step is an undergraduate degree. Many of you will have studied the Bachelor of Speech, Hearing and Language Sciences or Bachelor of Speech and Hearing Sciences at Macquarie, or another relevant degree that contains the prerequisites in linguistics and psychology that we require for entry to the course. Then the course itself is 2 years in duration, and during that period of time, you're intensively learning how to work as a professional speech pathologist, apply all of the wonderful knowledge that you've gained in your undergraduate degree to working with people with communication and swallowing disabilities. And then this third step, which isn't really a step, is leaving the course and entering hopefully a job that you really, really enjoy and love. So one of the real strengths of the course at Macquarie, the Master of Speech and Language Pathology, are our placements. In our placement program, we really put students into a wide range of workplaces to learn from expert speech pathologists how to do speech pathology work. We also, a really key characteristic of our course is that we are placing you from the very beginning of our degree. Other courses, it takes a little while for you to actually get out into placement and get, hands-on experience as in speech pathology work. But that's something that we're seeking to do from the very, very beginning of our degree, the 4th week, in fact. And we have a variety of partnerships, both with internal placement providers. So we have the Macquarie University Speech and Hearing Clinic and Macquarie University Hospital. We have relationships with places like Royal North Shore and Royal Rehab, and some other public hospitals, as well as a variety of other placement providers. So over the full duration of the course, you'll get a really rich variety of placement experiences across the full range and scope of speech pathology practice. So each speech pathology course has a bit of a different flavour. In the end, you kind of all reach the same point if the course is accredited. You're ready to practice as a speech pathologist, but each of them have different themes and different strengths. And I think for us, a real strength of our course is applying basic science about speech, language, and communication in speech pathology practice. Okay, you guys have, who have done the relevant prerequisite units have gathered a lot of knowledge about speech, language, and communication so far. We're teaching you how to apply that in an expert way with your clients. We're also really focused on developing professional reasoning as clinicians. So the contrast I've got there is clinicians, not technicians. We don't want you sort of turning up and doing the same thing day in, day out with every single client. We want you to be really thinking carefully about each individual client, thinking carefully about the evidence base that's available to support our practice, to come up with really subtle, well-designed plans for your clients. We also too want you to be innovative, and we want you to be ready to practice in a changing environment. We've all seen the sort of instability across various sectors over the past 2 years. God, 2 years, it is 2 years almost, isn't it? It's been a long time. There's been a lot of instability in a lot of workplaces, and we really want you to be able to critically respond to that as a graduate of our course. So as I said, a diverse profession, we give you diverse placements, and that means diverse workplace opportunities. So our graduates are really highly sought after and go on to work in a wide variety of settings. There's a lot of demand for speech pathologists at the moment. And, you know, by the time we get to graduation, when we're allowed to hold graduations, very few students who want to be in work aren't in work. So yeah, speech pathologists are really in high demand. In terms of some of the other advantages of Macquarie, I think we do have a really nice learning environment, both socially and in terms of our facilities. As I said, we've got lovely on-campus clinics and we've got lovely teaching spaces. We also have, I think, a really good advantage in that our class sizes are reasonably small for speech pathology courses. We usually have around 40 students in each cohort, which I think is quite a nice number. I know everyone's name and I have some knowledge of most of the students in the course, which is really lovely as an educator, but I think it's also really nice as a learner as well. So as I said before, you know, we have a real focus on applying basic science in language and communication to speech pathology practice. And if you're really fascinated and engaged by the world of linguistics and language, then, you know, we might be the place for you. Okay, so there'll be an opportunity to ask some questions about the course as we move on. Please make sure that you take that opportunity, use the chat box if you want, or when we get to the bigger Q&A period, you can probably unmute yourself and have a chat with me. So thank you very much. I'll stop sharing my screen and hand back to Ella.
Thank you very much for that, Scott. I will hand over to Madula for your presentation.
Thank you. Hopefully you can see the screen. So good evening, and it is lovely that all of you have been able to join. It is an unusual time, but hey, we've all adapted. So this is innovation at its best. We're all meeting virtually. So my name is Madula, and I am the course director for Master of Clinical Audiology. And note my email just in case you have any questions that we've not been able to address in this session. Now, before we progress, hopefully you know this already, and that's why you joined us, because this is what you want to do. But the way I saw audiology as a combination of a science and the art. The science, because we do need to learn and practice, as Scott also said about evidence-based practice, but the art because it varies. There is no one solution for every client you see, or at least we hope you don't view it that way. So that's the art part of it. In terms of audiology and what an audiologist does, you're looking at prevention, detection, diagnosis, management of hearing loss and its associated disorders. So while you may think about audiology, you know, hearing loss, okay, there's hearing loss and you got to address it. Surprisingly, people with hearing loss have heterogeneous profiles. It's not a simple thing that it's just about hearing loss. It's quite complex. It spans the whole age range. So we are looking at adults, children, infants, neonates, and you're looking at not just the hearing, not just a tiny cochlea, but there's vestibular, there's the whole auditory pathway. You're looking at devices, you're looking at management that goes beyond devices. If you're musicians, you may have heard about it or come across this experience of ringing in the ear. So the bottom line is that while audiologists manage hearing loss, but the associated disorders that are more subtle but have to do with your auditory system are also a part of this, I guess your work practice and your scope of work. I also wanted to give you, hopefully you can hear the sound. We did practice it earlier. Did everybody heard that? Because if you did, hopefully you realize that was somebody basically either tapping, knocking, or running after you. And that's basically your auditory processing that enables you to know what sort of sound it is. And again, this is to highlight that audiology is not just about hearing, not just about perceptive sound. It is a little more than that. It's about how we process a signal that we have heard, and then how we make judgment call of what sort of sound is that, where is it coming from, should I escape, should I move, so on and so forth. So another, this is a bit of trivia. Over 360 million people worldwide experience disabling hearing loss, and it is regarded as one of the most common sensory deficit. In a continent like Africa, with 55 countries, I believe, there are only three countries that offer this course. So in general, there is a big gap in between what's available, the services that are available, and the services that are required. So let's come back to what we do here. So in terms of the study pathway, we are not specific to what degree you have. Any degree is acceptable. This degree is a conversion degree. It prepares you to be an audiologist. So it is quite flexible, but it is easier if you come from the science-based background, but not to say that if you haven't done much science that we can't prepare you. A good student and a good, dedicated, organized student can manage this course. In terms of the requirement, you do need to have a WAM of 65. Apart from doing your application, you are required to submit a 2-page personal statement, very similar to speech pathology. But here we want to understand, or you need to showcase your understanding of audiology, your reasons for joining the profession. What do you think you bring to the field, or how you can contribute to the field, and any explanations you think are relevant to strengthen your application. Add them in. Do not make it longer than 2 pages. In terms of completion of degree, post 2-year degree, there is a 6 to 1 year supervised work internship. That's your negotiation and your work with your employer. So you are employed after the 2 years degree, and it is paid work. And after you've completed this work internship, you are regarded as an independent practicing audiologist. In terms of what's the course structure, I've just given you what a typical course structure would be for year 1. Some of the units, these cover linguistics, so phonology to clinical audiology, the bread butter stuff that you're going to be doing. So we teach you right in the first semester itself, anatomy, physiology, clinical application, of course. And then you go on to the second session. You learn more about the devices, you learn more about assessing pediatric population, etc. In terms of our format, most of the teaching material is online, but it is supported before COVID hit us. And once we are out of it, you're vaccinated, we should be back to face-to-face consolidation lectures, hands-on tutorials, and of course the clinical placements and the clinical units that are face-to-face classes. In terms of placement, Audiology Australia recommends formal intensive relationship-based education and training, which is case-focused, supports, directs, and guides students' clinical development. There are requirements which were changed, but keeping in mind the COVID scenario and the novel, experience for all of us. But we all accommodated, adjusted, and I guess that's a part of being a clinician. You take on whatever life meets out to you, and you work from that. And that's what we did. We've got our students doing clinical placements online, but of course there is face-to-face placements. And again, like speech pathology, we have a variety of experiences, and you are meant to be going to all of those during the 2-year clinical program. If once we go back to face-to-face, which is hopefully next year, you are required to do at least 2 one-week placements each session. Now, because we do There may be some adjustments for next year, at least in the first semester, but the second session, we may be back to this scenario. And even if it's not face-to-face, it will be online. We do not believe in any breaks, I'm afraid. So when I tell you that it is an intense program, believe me, it is. And you can ask the students who are online today about that. In terms of the placements, if they are face-to-face in the regional areas, unfortunately, the responsibility and the cost of that is up to you. There are a couple of grants available, and we provide you with those opportunities and assistance with that. Like speech pathology and like what Scott said, we are well regarded in the field. The program that we provide in Macquarie University is the focal point of hearing, speech and language research and teaching. University has recently adopted a hearing strategy, focusing and creating a focal point towards audiology and hearing research. We do have, when we say that we are a core member of Australian Hearing Hub, which is this building, what that means is that we have collaborators who are service providers, industry partners, and they're all housed or at least have representation there. We have the Center for Translational Hearing Research is a part of the audiology course. Like speech pathology, we are also accredited. We were accredited in 2019, and the next accreditation is in 2024. We provide the practical experience in a variety of ways. We have industry partners helping us run courses and workshops to enable you to experience what is new, what is novel, what is innovative. We have 12 Commonwealth supported placements that are merit-based and or a rural remote grant. You don't really need to do much when you're applying for placements. You basically just have to tick and provide if you belong to the Aboriginal and or Torres Strait Island communities. Other than that, every application is considered for these grants. I guess we have to talk about this job prospects, and they are strong despite COVID. All our second year students have been interviewed, and by the time the students graduate or close to that, there is everybody does receive a job offer. There are more job opportunities in remote and regional areas than there are in urban areas, at least when you're starting out, but that brings about a different challenge and actually more opportunities. So I wouldn't disregard that experience. And of course, starting salary is something you can negotiate, yeah. Important dates, this is for you to know that the applications are open. 31st of October is when the closing date is for the applications. Please adhere to that. The first round of offers would be given by the mid-December, and then if we have placements, there might be a second round offer. The introductory 3-day workshop will be start in that week of 14th of February. So please note that if you're applying. And once again, there's my email. And yeah, so I do notice that there are lots of questions online already available. So yeah, let's get on with that. Thank you very much.
Thank you so much, Majula, for your wonderful presentation, and I'm sure our prospective students have gotten a lot out of both of those presentations that we've been able to hear this afternoon. We will now move on to our panel discussion. So all the panelists that I did introduce at the beginning of the webinar will come on screen and we'll be able to talk a little bit about their experiences, and I'll ask them some commonly asked questions from prospective students. So again, if you guys do have any questions, we can see them in the Q&A chat, which is amazing. So please do just continue to pop them in there and we will get to them in a few minutes. But for now, we'll just discuss with our panel a little bit about their experiences so far in the course, or any tips they have for prospective students. So I will start off with Carla and Helen. You're both in your final year of your master's degree. What have been the highlights of studying the course, and can you share with us any placement experiences that really stood out to you? So Carla, would you like to start us off?
Yeah, hi, so I'm Carla and I'm in the second year doing the Masters of Speech. So probably for me, my highlight of the thing that I've enjoyed most about the course is that I've really enjoyed like the collaborative learning experience that the program has to offer. So this was quite different to my experience working or doing the undergrad, which was the speech and hearing at Macquarie. So I found during this course, you really had the opportunity to engage with the teaching staff. And I think that was a key aspect to the learning opportunity. Similarly, there's a really great collaborative approach to working with your peers and your classmates. So you're able to also engage with them, work with them to complete coursework, brainstorm, discuss placement opportunities. And corresponding to that, it's been a really great social aspect of the course. So through, I guess, completing the work and socialising, I've made some really great friends out of the course, which has been a key highlight for me. With regards to my placement experience, I've had a really great opportunities provided, and I think it's really allowed me to grow my understanding of the areas that a speech pathologist can work in. Because until I started doing the course, I don't think I was really aware of quite the range of, I guess, workplaces and opportunities that a speech pathologist might engage with. So I've had the opportunity to work in an adult placement in an acute hospital setting, and that primarily involved completing swallowing and bedside communication assessments for patients presenting with a range of conditions. So that was following traumatic brain injury, or post with neurodegenerative diseases, or post-surgery. Another adult placement experience I've had was working in a rehab hospital, and I really, really enjoyed it. I found it so interesting, not just working with the patients and providing intervention and assessment, but I guess in the bigger picture of that setting, being able to work alongside my peer quite closely and my clinical educator, which is like your supervisor during placement, and then also the whole allied health team, because it was quite a multidisciplinary approach to it. So I think that placement really gave me, I guess, the insight and to the different types of workplaces that you might see yourself post-graduation, and what you would consider, I guess, appropriate to you working when you graduate. I've had pediatric placement experience in a school setting. So that was 1 day a week where we went into the school and we pulled like students out of the class and provided intervention to them. And my other placement experience was a regional placement, and it was in Wagga, and it was a 5-week block with 2 other classmates that I went with, working in a community health setting. So I was really grateful for that placement as well, because I really was keen to, I guess, experience speech pathology outside of Sydney, as well as within a community health setting and working within a public setting. So that was a really great experience as well. So yeah, maybe I'll pass over to Helen for her audiology.
Hi everyone, my name is Helen and I am in my final year of the Master of Clinical Audiology program here at Macquarie. And so there are so many highlights. I could talk forever, but I guess I'll just focus on the main ones. First, just relating to the course itself, you have a really small cohort, so you get to know everyone really, really well, and everyone's so supportive and passionate about audiology. So it really builds the morale and brings support together. And then as Majula mentioned, a lot of the content is pre-recorded online. So there's a lot of flexibility, and then you come together weekly for consolidation classes. So you can really ask questions and confirm and consolidate your knowledge in that sense. And then in terms of placement, definitely a huge highlight of the course. I've had a few placement opportunities, very much ranging in terms of what I've been doing. So I had one placement, a regional placement up in Cessnock in adult rehabilitation. So I got to see a bit of a different clientele to, I guess, Sydney, what you would expect to see in Sydney. And that was just a great opportunity for me to dive into hearing devices and hearing aids and hearing assessment and really see what was out there. And then my second thing, from little newborn babies getting newborn hearing screening to some older kids, and a bit of pediatric rehabilitation there as well. So you get the opportunity to be in so many different settings for placement, clinics and hospitals, school screenings in both metro and regional areas. So you get a really good taste of the different areas of audiology and the range of clientele that audiologists work with. And then as also part of the course, in second year, you can book in for the clinic downstairs, and so you can actually bring your family and friends in yourself and practice on them and show off your skills, which is really exciting. And then also what I really love is the social side of things. So I've been fortunate enough to be part of the executive team for the Audiology Student Society. And so as a student, you are able to join the society. And I guess my favorite part was the mentoring program that we have. And so when you come in as a first year, you have the chance to become part of a group mentoring program, which is with obviously the first years, but then the second years. So straight off the bat, you have that communication between the second years. So bringing those cohorts together. And just one last thing I'd like to mention is you can become a student member of Audiology Australia. And so that sets you off right at the start in Audiology Australia, the accrediting body. And they run conferences, and specifically one for students, which we just had, which is called Inspired. And that was a great way to network and hear from a range of audiologists and learn a bunch of skills to set us up. So yes, as I said, I could talk forever, but I'd say those are my favorite things that I've loved and have experienced in the masters. And there are some questions, but I guess we can answer those in the Q&A later.
Thank you so much for sharing your experiences, both of you. And I think it's really great to hear how you've had varied experiences and a varied range of placements, but how you've enjoyed your time at Macquarie so much. So thank you both very much for that. For Rebecca and Michael, what does a day look like in the life of a speech pathologist or audiologist? Are there any challenges or really rewarding moments that have stuck with you thus far in your career? I might begin with Rebecca.
Yeah, sure. I've worked in a few different positions currently. I started off in a research position. I've done a bit of work in private practice, and now I'm working at a community health centre in Alice Springs. This is by far probably my most exciting job so far. Day to day, my role can look really different. To give some context, we see children aged from 0 all the way up to 18. We see a range of different practice areas being in a remote setting. So we work with pediatric feeding. We see fluency, speech and language, voice disorders, disability, and AAC. So really the full spectrum. We also do a lot of regional and remote work to communities of Central Australia. So we cover from the South Australia border all the way up to Katherine, which is about halfway to Darwin, and then east to west borders. So yeah, my job can look really different day to day. When I'm in Alice Springs, it's pretty consistent with any community health setting. We see a lot of clients work in preschools, childcare centres, schools, all those different service deliveries. We have a huge multidisciplinary team. So we work with audiologists, physiotherapists, occupational therapists, dietitians, nutritionists, list goes on. We do some really cool stuff in remote communities. You sort of get to be involved with a lot of different things. So we have an ASD clinic that is involving all of the allied health professionals in the diagnosis of ASD, which is pretty cool. Working in Central Australia as well, we get a lot of opportunity to work more at a community level. So we obviously, have family-centered practice, but we also get to target those higher levels of community engagement and capacity building services. It's also been really great for networking, and I've been able to start working on some exploratory research studies while here as well. When we're working remote is probably the most challenging but exciting part of my job. There's a lot of challenges due to, the setting and the different sort of social determinants of health that impact the Aboriginal peoples in Central Australia. So that can definitely be challenging at times, but we also get to go work in communities that usually wouldn't be open to travellers. So that's a really great privilege. We spend a lot of time in the car and on small aircrafts and bunking with the people we work with. So it's a nice family environment. Everyone's really super supportive, and it's a wonderful role that I'm currently working in.
Thank you so much for sharing. And Michael, what would your day in the life look like?
Thanks. Yeah, I came to audiology in midlife after about a 20-year career in media production for radio and television. So I'm a recent graduate. I'm a graduate of the 2019 class. Last year, I completed my compulsory internship with the public sector audiology provider Hearing Australia, and that's where I'm presently employed. I've lived in Sydney most of my adult life, but I took up an internship regionally. I work in Tamworth, and moving regionally, as Madula pointed out, was a possibility which I recognised was on the cards when I was researching the course, much like you are now. My day-to-day work involves mainly adult assessment and rehabilitation work, and this translates broadly to a lot of hearing aid fitting and troubleshooting work. I also have a smattering of paediatric assessment work for kids over 3 years old who can ideally tolerate headphones. In that role, I've regularly worked on Indigenous outreach too, and this makes for really good variation in my working week, and the opportunity to also travel regionally every 6 weeks or so. We also travel during the week to sort of day visiting sites around Tamworth. The travel's been somewhat curtailed with COVID, but we're considered an essential service. So, and Tamworth, hasn't been as locked down as the rest of or Sydney, at least, with stay-at-home orders. So that's been quite good to be regional in these past couple of years. It was a really, dare I say it, great time to leave town. Day to day, though, in my adult rehab role, I'd see anywhere from maybe 8 to 12 clients. Appointment lengths are quite varied, and they really depends on what needs doing. A typical day will have a mix of initial assessments, hearing aid discussions, hearing aid fittings, and then ongoing client review and follow-up assessments. This year, I've also started seeing more complex adults who have usually more profound hearing losses or other complicating health factors where they might need a bit more of a considered approach. So adult rehab and complex adults are where I think my future lies in audiology. I am a hearing aid user myself. That's the reason I got interested in audiology in the first place. I think my favourite thing about the job so far has been getting to follow older couples on a journey. When one person in a relationship has a hearing loss, it very often results in frustration for both people, especially when the person with the hearing loss avoids doing something about it. So my job is hopefully, to lead both of them down a pathway of better communication and social inclusivity. I'm relatively new to this career, but I'm finding I'm getting a lot of joy out of, seeing repeat clients, people I saw a couple of years back, having treated them now for a couple of years. I didn't really think I'd sort of enjoy that particularly, but I am. One of the main challenges for me early on, and I think this is pretty common to most new graduates, was time management. Each appointment's a discrete unit essentially and needs to be compartmentalised, but you need to do client notes in your reports, you need to fit it all into the day. Time management was, it's okay now. And look, most companies when you're starting out, they'll allow a bit of extra time for new graduates to complete appointments. The job is really, you know, it's a good mix of technology and people. If you like problem solving and people, this could be a really good gig for you. Thanks.
Thank you both very much for sharing your experiences. And I think it's really great for our prospective students to see that this career doesn't just lie in the suburbs of Sydney. It's great to really see the differences that you guys have been able to make in your careers as graduates. So thank you very much for that. I'll direct our next question to Scott and Majula. What are some important themes or trends within speech pathology and audiology that would give our prospective students some insights into their future careers? So can you impart any wisdom on our students that they might be interested for their future career as either a speech pathologist or an audiologist? Scott, I might begin with you.
Thanks very much, Ella. Look, actually, it's something that Rebecca touched on there. The profession of speech pathology has undergone some recent changes with its core competencies. We have a set of what's called professional standards, which are have been newly developed, which giving a new way of conceptualizing and describing professional work. And one of the things that's really clear in the professional standards, as opposed to the previous version of this document, is, you know, speech pathologists having a role at the level of community in addition to having a role at the level of an individual. And I think in the future, if these trends continue, speech pathologists are going to be having more and more kind of opportunities to ensure that the world is accessible and well organized for people with communication and swallowing disabilities. And we're going to be increasingly looking to meet the needs of distinctive communities that have speech language communication needs. I think another sort of upcoming trend, which has been around for a while, maybe it's sort of in a bit of a new guise now, is something called implementation science, which is making sure that we're getting the best research evidence into routine speech pathology practice. There's a lot of good research knowledge out there at the moment, but not all of it is making its way into routine practice. So, you know, speech pathologists are looking at, and researchers are looking at ways to get that evidence into practice and kind of reduce the barriers for clinicians to using that evidence. So I think, yeah, those are two trends that I can see in the future. And I think one last one to note there as well is providing really high quality services for multilingual people. And again, you know, maybe that touches a bit on what Rebecca was talking about. You know, Australia is a highly multilingual nation, both from the people who have lived here for thousands of years and from the people who've come to these shores more recently. And ensuring that speech pathologists can work effectively across all languages that clients speak is a really important thing. So our course does have some specific features that are kind of directed towards ensuring that our graduates know about implementation science, know about how to work with multilingual people, and if they're multilingual themselves, have an opportunity to think about what practice in their language could look like. So yeah, I hope that we're sort of we're going to be able to produce graduates who really meet those needs of the profession in the future.
Thank you, Alam. I should have let you step in first. So I would say, yes, audiology is changing too. We have been very focused on technology and tend to do so in some ways even now. However, technologies have kind of now gone out of our control. We're getting more over-the-counter hearing devices. And actually, it's also matching the demands. So people who don't have the obvious hearing loss are demanding a better ability to cope in very diverse and difficult scenarios. So that's changing how we target the population. But that's one extreme. There's also now, like Scott was saying, the implementation science, what we would call the translational aspect, that link between where's the evidence and what actually should be done. The focus on the bridging these concepts is more so now than it ever has been. And the third thing I would say is the demographics. like Scott said, most countries are multilingual now. The focus on having and concentrating on one language and just coping with that in your small, bubble is, I know I shouldn't actually use the word bubble. It's completely changed the world now and how it's used. But nevertheless, the multilingual population everywhere has made us aware that even with the hearing services, we need to change our perspective, have a better idea of how to cope when, our languages and our cultures don't match, but we still need to provide the service. And the last thing I would say is going back to what I said earlier about our focus has always been me, the audiologist, and a person, the client. But now our focus is becoming not just family-centered, but community-centered. So we're getting more and more into public health space. And that's actually a very nice perspective. I'm not saying everybody does that, but it's certainly an important perspective moving forward. So looking for solutions that are bigger than one person, and that changes practice. So I would say these are the immediate changes that are coming about in the field, which are very exciting.
Thank you both very much for that. And I'm sure our prospective students are really excited to hear about their courses which you've provided, but also kind of where the future of the careers are heading. So again, thank you for sharing those insights. I will go back to Carla and Helen now, because you are in your second year of the degree, so your mind will be heading into future careers. What are your career aspirations moving forward? Are there any big goals that you've had that Macquarie's kind of helped you realise, or have you had your eye set on one specific career for a little while? So Carla, I'll begin with you.
Yeah, so I think maybe my primary goal post-graduation for me personally would be to try and find a job somewhere outside of Sydney. I'm pretty eager to work somewhere a little bit more regionally and experience that. I'm not from Sydney originally as well, so get back to somewhere a little bit smaller would be a bit more up my alley. And ideally as well, I think I would have the preference, if available, working somewhere for a non-for-profit or community health setting. That's where I have a stronger interest. But I suppose because I'm still very early in my career, or early stages, new grad, I'm quite open to any opportunity or possibility really, and I don't really want to keep my doors shut on anything. And I'm pretty, I guess, keen to find out what there might be an experience where I find or prefer working and finding maybe something that I have a bit more interest in, because it is such a big profession. And I guess in my early stages, I'll be able to finding a little bit more clarity on what I'm most looking forward to. Thank you.
Thank you so much for that. And Helen, what about yourself?
Yeah, so I guess just to echo what Carla was saying, moving regional is something that we all really look forward to. So after you finish the 2-year masters at Macquarie, you complete this year internship program with a company to get your qualified practitioner number. And so this starts out at elbow supervision. You have your supervisor with you the whole time, helping you learn and developing your skills. And often this position would be secured before you even graduate. So a lot of us already have offers for next year, and a lot of those regional. So yeah, it's a really great opportunity to move regionally and get out of your comfort zone, try something new, and I guess become part of a more close-knit community. And then I didn't really mention it, but as part of the course, I've been able to do a thesis, and this is in tinnitus and tinnitus management. So I have this, I guess, passion now for moving into that side of things later on in my career, and really something that I'm going to work towards as part of my expertise. So yeah, very exciting things coming up next year.
Thank you both very much for that. And it's very exciting for our prospective students to kind of place themselves in your shoes and plan for the future. So thank you for sharing those experiences. We will round out the panel Q&A with this question for Rebecca and Michael. What would be one piece of advice you would offer prospective students wanting to enter the profession? So if there's anything that you've learned thus far. Rebecca, I'll start off with you.
Yeah, this is a really hard question for me to answer, because I feel like there's so much that I could say, but I think the biggest thing is to keep in mind that transitioning from uni to employment can be really tricky. And I'm one of those weird people that loves my job. I'm so excited every day to go to work. And one of the reasons that is because there is so much that you can do with a speech pathology degree. And you almost won't realize how much that there is that you can do until you start working. So I guess my most valuable piece of advice would be to keep a really open mind. Don't be too stressed about working out exactly what you want to do in your 2 years that you're studying. I left uni saying I didn't want to work in peds, I don't want to work in private practice, and I don't want to work in disability. And I did all three and absolutely loved it, and I'm still doing it. So don't put too much pressure on yourself. You guys, I think, will be spoiled for choice when you graduate. So just really think about what your values are and how you can sort of match those to the values of an organization, and use that to prioritize the jobs that you accept. And also, as the girl sort of touched on, do not devalue the experience that research can provide. It's been a really wonderful opportunity to contribute to the profession in a way that you can't do in any other setting. So if you are interested in research, definitely pursue that as well.
Thank you so much for those insights, Rebecca. And for yourself, Michael?
Thanks. Yeah, look, my advice would be to not just for audiology, but any postgraduate course which is vocationally oriented is really foster the professional bonds that you form during your course. Students from my cohort also commenced an internship with Hearing Australia. We established a messenger group in the first few weeks after we landed, and it's just been like super simple and really liberating to lean on former students who get where you're coming from for troubleshooting and just, you know, venting on work matters that you couldn't necessarily do with your face-to-face colleagues. My other quick bit of advice, which has also cropped up, and that is, and I see a comment there too, that, you know, this course is extremely rewarding and you make some great relationships, but it's a relentless couple of years. Medulla's not lying. Academically, I was really lucky to have the support of my partner, so I didn't have to work. But if you need to work, as most people, you know, need to support themselves, realise that you need to fit your study in around that job, not the other way around. But I love my time at Macquarie, and it's, you know, it served me really, really well. And good luck, everyone.
Thank you both very much for that. And again, I'm sure the students really take a little bit of calm being able to have those tips from people that have been through it and have studied it themselves. So thank you again for that. That does bring us to the conclusion of the panel discussion. So what we are going to do now is we will split into 2 breakout rooms, and we will have audiology in one and speech pathology in the other. So this is when we'll go through the questions in the Q&A, and we'll have the relevant panelists in each room. So you'll be able to get your questions answered either live, or there'll be a typed response as well by the people that can answer them the best. So enjoy the rest of the panel discussion and wish you all the best.